an example of an entity that I think comes up pretty common in day-to-day practice, but this particular example of the entity is so large that in some instances it can be a little bit confusing for the reader. Now notice on the T2 weighted images that this lesion is incredibly hyperintense, very bright, and if you look at the T1 post-gadolinium images at various stages of contrast enhancement, early, portal, delayed, you can see that this mass shows peripheral, nodular, globular enhancement with gradual centripetal fill-in. And if you look at the images acquired many minutes after the initial injection of contrast enhancement, large portions of the mass are filling in the contrast. This is a classic example of a giant hemangioma. It's large, it looks really ugly, but at the end of the day, it's still a benign entity, something that you don't need to do anything about, particularly in a patient who's not having any symptoms or other clinical issues. A giant hemangioma.